So, good evening, everyone. I'm so glad to have you all here with us. My name is Rhonda Heights, and I am a Parent Resource Coordinator at the Munroe-Meyer Institute, the University of Nebraska Medical Center. Here with my coworker, Jennifer Hansen, another Parent Resource Coordinator. So we're really happy to have you all with us this evening. Tonight, we're going to be talking about the home and community-based services. We're so fortunate to have Tony Green here from the Department of Health and Human Services, Division of Developmental Disabilities, to review and kind of give us an overview of the programs to help families understand the differences between those. So a little bit about our program. The Family Care Enhancement Project is the program that I work for. And part of that is the parent resource coordinators, who are parents of children with disabilities or special health care needs, who help other families access resources, find services, navigate systems, and kind of sharing their own lived experience and hopefully being able to kind of help families walk through those systems together. We help with the social determinants of health, which would be meeting some of those non-medical needs. So a lot of times we might get pulled into at the clinic for a family who's having trouble with accessing transportation services, or maybe they are needing to know about respite care. So those are some of the things that we can help with, get people connected to. As you can see, we are a growing team across the state of Nebraska. Currently, there are a number of us in Omaha. I think it's 5 or 6. I can't remember right now. But we also have some of the other clinics, such as One World, Boys Town, Children's Physicians in Kearney, Complete Children's in Lincoln, Lucem Health in Lincoln, and Midtown Health in Norfolk, as well as Charles Drew in Omaha as well. So again, it's a kind of a growing program. We're looking to reach out, go even further out in the state to provide those services and help family access programs. So tonight, just a couple of housekeeping things as we're getting started. We are recording these sessions. So this link that you see here, this is going to be where all of the sessions that we're doing online are going to be housed. The session that was 2 weeks ago, we're in the editing process, and so that will be posted there shortly. But this is where this session will be as well. So if you want to come back and review, or if you would want to share with someone else, that this information would be available at a later time. So because we are recording, we do ask that you please keep your computer muted. We have a number of people who are scheduled or registered to participate. And so just to make sure we're not talking over each other, that will really help. So one way that you can submit questions, because we still want to get that feedback, is through the Zoom chat, which will go directly to Jennifer, and she will be able to then post those questions to Tony. And lastly, we have a poll that will be at the end of the session that really helps us understand whether or not we are hitting the mark and getting you information that is useful and helpful, and how we can kind of shape going forward future sessions. Again, here's some contact information. I think this was also sent out to you earlier this afternoon if you were registered before noon. I did go ahead and send out both of those presentations for this evening. But if you would like to get a hold of either myself or Jennifer, this is our contact information. I didn't include our phone numbers because currently we are working remotely. So email is really the best way to get a hold of us, and then we can set up a meeting if we need to from there. So tonight, Tony Green, like I said, the director for the Division of Developmental Disabilities for the state of Nebraska. So excited to have him here. He's always got lots of great information for us, and is willing to kind of share that and help families kind of figure out and navigate these systems. So with that, I will go ahead and let Tony take the lead. And my stop share moved on me, so I have to. Okay, Tony. Can you all see the presentation for Tony? Okay, awesome. Great.
Can you hear me now?
Yes, thank
Yes.
you.
Okay, perfect. Thank you. A little trouble. I'm still always every one of these, whether it's Zoom or WebEx or.
Well, you can say that this was not your fault because I think I had you muted, so it was not on you. So I apologize.
That would be the first. Well, thank you very much. And again, to all of those on the phone, appreciate you taking the time to step away from your normal evening and visit with me about our home and community-based waiver services in Nebraska. Very, very briefly about me for those perhaps that haven't had a chance to meet me or work with me yet. But I am Tony Green. I am the director of the Division of Developmental Disabilities within the Health and Human Services System for the state of Nebraska. I actually started my career in developmental disabilities. This is actually year 30 for me that I am wrapping up here at the end of this year. Started out as a direct care worker in college, supporting some gentlemen in a home, and graduated, moved into the service coordination arena with the state, and left the state for a brief period of time as a contractor and was the director of a provider agency providing waiver services, and then came back to the state, did some work in child welfare and adult protective services, and then back to developmental disabilities as the deputy director, and officially in August was appointed as the permanent new director for developmental disabilities. So glad to be here with you all. And hopefully we'll have an opportunity to interact throughout this process. I'll try to stop periodically and just check in with questions that maybe have come in. And certainly, and I'll say this again at the end, but if there's things that you're uncomfortable with in this kind of forum, perhaps asking or typing, you are always more than welcome to reach out to me personally at my email, and happy to get you an answer. So tonight, I'm really going to plan to just kind of walk through the 4 home and community-based waivers that the division runs. But I'll kind of start off a little bit giving you just a brief overview of what DD is responsible for. And so you'll see on your second slide there, if you have those in front of you or up on the screen, that really we're charged with making sure that we serve as many eligible people as possible while ensuring health and safety of those served. We are responsible, obviously, for the delivery of the home and community-based waivers in Nebraska, which does include initially determining eligibility, obviously providing the funding for those waivers, and then the oversight. You'll see a box there on the screen that talks about maximizing federal funding for folks. And so one of the requirements of all states from the federal government, because waivers are funded by Medicaid, so Medicaid applies rules that say in order to access federal services, you need to make sure that you're utilizing all other funding sources that also receive federal money before Medicaid would pick up services. So that's generally in our waivers why you would see the statements kind of alluding to number 2 there, that you have to use other funding sources that are available through State Department of Education, Nebraska VR, and other agencies. And so what that means is when it talks about State Department of Education, you'll often hear things like school is responsible to educate folks through the school year in which they turn 21 or until they graduate. And you'll hear folks say, don't graduate before 21 because there wouldn't be services available. And there's truth to that generally, in that if the person is going to need ongoing continued support, the assumption is the IEP should have continued likely through the age of 21. And so that's an example of how that using other funding sources that are available need to be exhausted prior to waiver services being available to folks. And then you'll see, again, on your next slide, some administering the 4 waivers that we really, what they do is they allow us to provide services in the community for folks that generally meet a level of care to live in what Medicaid would call an institution. And so you will hear our services are related to nursing facility or intermediate care facility, and those are the waivers that our programs cover for those 2 levels of care. Waiver services are meant to complement or supplement things that are already available in the Medicaid state plan. So folks that are generally on Medicaid, you get a certain array of services within Medicaid, generally your physical health, behavioral health, mental health, pharmacy coverage. And so the waiver is meant to complement those, not replace those. So one of the requirements is that states can't provide anything in their waiver that's available already in their larger Medicaid state plan, that the waivers are really to supplement the other Medicaid funded services. And then there are some exclusions that are very explicitly implied that we cannot cover under waiver services, which would be things like room and board, general home repairs, anything that's funded obviously through state plan services, voc rehab, schools, things like that. Okay, so when a person, if you can go back. Yeah, when a person is receiving waiver services, they're in essence participating on the waiver. In order to be eligible for a waiver, everyone has to have Medicaid. And so one of the criteria to even be on the developmental disability waiting list for the DD waivers is you have to be, if you're an adult, you have to have Medicaid. Otherwise, you're technically not even eligible for the waiver and can't be on a waiting list. Children, we do exclude the requirement for Medicaid because if a waiver slot is offered, different eligibility criteria applies, i.e. we wouldn't be using the family income for waiver participants. So we go ahead and allow children to be on the wait list, but adults have to have their Medicaid eligibility.
Tony, can I just interrupt you for a second?
Yeah.
I think this is one thing that I hear frequently from families as far as there being confusion about whether or not if you have a child under the age of 18 or 19 and that family income component to being able to be eligible for DD. So I appreciate you kind of explaining that, but I don't know if maybe it would be possible to go a little bit deeper into how that works or how they figure that out. Because a lot of times I think that's a hindrance for people even applying.
Yeah, so, and it's, so for the DD waivers, if we have children that would apply under the intellectual developmental disability traditional comp or day waiver, if they meet the criteria in statute of having an intellectual or developmental disability, they automatically, as children under 18, can go on the wait list without the Medicaid being active. Now, if the family is already on Medicaid because they qualify outright because of their income, then that's fine too. But if the family is over resources and ineligible for Medicaid, we do let children remain on the DD wait list, but they can't really access any services because they don't have that Medicaid. So what happens, let's say they're on the wait list and their name would come up for a funding offer. What happens when we make that funding offer, if it's accepted, we automatically, DD, would notify Medicaid to say that client A has accepted a waiver offer. We need you to, well, one, the family would have to apply. And then we flag that application, tell Medicaid to run the budget with the institutional rules applying, meaning that they would run the budget on a family of one, meaning the participant and their income only. And so having a waiver slot puts you in a different Medicaid eligibility criteria, where if they didn't have that slot, in order for the child to get Medicaid, it would have to be on the family's income. But once you get the waiver slot, we move over to a different eligibility category that allows us to consider that child a family of one. Okay. And then the other criteria to participate in a waiver is you have to meet the level of care for that specific waiver. So the aged and disabled waiver and the traumatic brain injury waiver that I'll talk about later, those are two waivers that require nursing facility level of care. And then the two DD waivers are folks that require intermediate care facility level of care. And an intermediate care facility are placements like the Beatrice State Development Center, BSDC, or some folks might be familiar with Mosaic at Extell, their campus, or Mosaic Beatrice, their campus, or there are a couple smaller community-based ICFs around the state that Mosaic also administers. But you have to qualify to live in the 24-hour intermediate care facility in order to be on the DD waivers. And a person may be eligible for more than one waiver, but you can only receive one waiver at a time. So we've had some and very good questions, especially in recent months, where we've had folks kind of move from the aged and disabled waiver over to the developmental disability waiver. It is possible to meet eligibility criteria for both, but it is not possible to receive a service from each of them. So we've had families say, well, I like this service over in aged and disabled waiver, but I could also use this in developmental disabilities. And unfortunately, at the federal level, you have to be in one, you can only be in one waiver. Now, what that does though, is if folks are saying that there's perhaps a gap, states can certainly identify what services they want within each of those waivers. So something that we could work on as a state, but you can only get services under one waiver. And then generally the rules are, once you're in a waiver program, that you really have to use a service every 90 days for that waiver slot to remain active and be eligible for the program. Again, remember that in order to get these waiver services, it's for folks that meet the level of care for a nursing home and folks that meet the level of care for an intermediate care facility. So if somebody could go 90 days without a service, it begins to raise the question of, then how do they qualify to live in a nursing home, which is 24-hour care, right? So that's one of the expectations at the federal level, is that you must specify in your waiver how long you would let somebody go without accessing a service before jeopardizing their placement. And then there are some exceptions for that you can see as far as being hospitalized or in a rehab facility, short-term, things like that. Okay, and then I mentioned earlier we have the 4 waivers in Nebraska, and you'll see there the comprehensive developmental disability waiver and the developmental disability day waiver. So you'll often hear those referred to as the comp waiver or the day waiver for DD. The day waiver is generally, as you see by the description there, the waiver that folks who are leaving the school system at 21, that's the waiver that we offer them by statute to replace their day services that they're leaving from the educational system. And then the comp waiver has all the same services in the day waiver. Really, the main difference is the comp waiver provides the 24-hour residential service that the day waiver does not. But in the day waiver, one thing that folks don't understand, or it's not well known, of course, there are budget restrictions, obviously, but within that developmental day waiver, there are in-home residential services and independent living services. So you could live in your own apartment and get intermittent support. So there is a residential component in that waiver. It's just not the full 24-hour service that some people are accustomed to, a group home or a shared living provider. That service is only available in the comp waiver. And then we also are supporting the aged and disabled waiver, again, for people of all ages who are eligible for Medicaid, require nursing facility level of care. And then our traumatic brain injury waiver, which is also for folks that meet nursing facility level of care and want to live in assisted living. Right now, the traumatic brain injury waiver only offers one provider, and it's an agency-based assisted living service. So that is a waiver, I think, down the road that we need to explore, perhaps some in-home or additional services. But today it is just assisted living services with quality living in Omaha. So let me stop there before I go in. My plan next is to kind of go through each of the 4 waivers and kind of talk about what they are. But from that high overview, any questions before I start down that path of each of the waivers?
Tony, we have had a couple of questions that have come in. One wondering, can voc rehab be defined?
Sure. So voc rehab is a agency within the Nebraska Department of Education. And I will, if there are any VR folks on the phone, I will not do you justice in all the work that your agency does, but I'll try to simplify for our purposes. voc rehab is the agency that works with students as they're transitioning out of the school system to get them skills that will make them employment ready. Either employment while they're still in school, or certainly when they transition into employment. And then certainly on the adult side, after they leave school, our DD agencies and other providers work with VR. Their goal is really to get folks integrated community competitive employment or customized employment. So it's really, in its simplistic form, it's an agency that really supports people with disabilities to get employment.
Next question. Sorry, I apologize.
I missed that one.
No, I lost my chat, so I was trying to get it pulled up here again.
Oh, okay.
I apologize for that. Okay, so this question is about why would a family, kind of maybe clarifying the application process of having a family apply, but why would you do that if your child is on the list? So maybe just kind of clarifying what that process is, going from application wait list to then being made an offer.
Yeah, so folks are always encouraged to apply or make application. And again, this would be for the specific to the developmental disability waiver, because you will find in the aged and disabled traumatic brain injury, certainly aged and disabled, there is not a wait list. And so this wait list piece applies to the DD waivers. But folks are often told and encouraged to apply whenever they are ready and want to get on the list. Many times folks will advocate to get on as early as possible. So, you know, I have children under 1 year of age that are on the waiting list for developmental disability. It's just something that they've done. And again, there's no right or wrong answer. You can apply at any time. Because we have a waiting list, and this is true because it's by date of application, that's where you'll hear the get your app in and get it in early, because that then puts you kind of in line ahead of anybody else that comes later. What it also does, though, is it when you get to your place, we no longer have, and this would be for folks in the old system, we used to make funding offers to folks and they would deny the funding offer and then change their date where they were on the wait list and say, call me back in 2 years or call me back in 5 years, I'm fine. Kids are in school, the IEP is covering all my services. I've got natural supports meeting our needs. I don't need services today. And then they would self-select and identify a date in the future that they wanted us to call, but they were still on this registry of unmet needs. So the new waiting list is really trying to get at, if you are on the list, we're trying to get to a place that says you're waiting for services, meaning if we call or funding becomes available, you have to accept the offer, or you lose your place on the waiting list, and actually you have to reapply, go through the whole DD application process again. So the benefit of applying early would be twofold. One, for you to secure a place on the waiting list by date of application. The other piece that is good about getting folks on the list is it really helps the division, your senators, legislators, for planning purposes, so that I can project for many years out how many students are going to be graduating in a given year from the school system. We're generally pretty close because most folks are on the waiting list that need services. We've done a really good job over the last several years of getting people on the list. There was a period of time where we kind of stopped engaging school systems and teachers making referrals, but we started back up with that a few years back, and I think we've caught up with most of the students that we missed. So it really helps for forecasting budgets, and that for conversations that obviously we have with the senators on how much funding we're going to need for folks coming into the system. But it is, you know, when you hear conversations about X number of people on the waiting list, it doesn't always mean that it's that many people that need a service today. Sometimes people really are on the waiting list, but they don't really need any support today. But they just put their name in and got their spot in line because currently that wait list is several years. We're currently making offers in year 2011 application dates. So it does fluctuate as far as how long people are on that wait list. But I don't know if that helps explain kind of the process, but folks apply, they get on the list, and then as money becomes available, either through a specific appropriation from the legislature or through money that we have within our existing budget through attrition, we're able to make offers off of the wait list. And the statute, which I think we cover later in one of the slides, will outline the order in which we have to give funding to folks by statute.
I think that's really helpful, Tony. And I think it's a really good point that you make as far as like for future planning to know how many people who may be utilizing those services at the time when they're going to really need them, or as they maybe are transitioning to adulthood or what have you. So that's another good thing and a good point for people to understand. Next question that I have is, at what age or under what circumstances would a participant transition from the day waiver to the comp program, to the comp waiver, excuse me?
Okay. So if a student were to get their offer for the day waiver at 21, and they can remain on that waiting list for the comp waiver. So when I talked about folks only getting services from one waiver, sometimes that confuses folks to say, well, how can I do that? But it's okay to wait for one waiver while you're on another waiver. So you will see that for many of the folks on the current waiting list are actually already on the aged and disabled waiver, but they're waiting for the comprehensive DD waiver. Or there are currently about 600 plus folks that are on the day waiver for DD who are waiting for that comprehensive offer. The only way after getting that day waiver when they leave the school system that folks will get that comprehensive day offer is you have to fall into one of the 6 priority categories by statute. So If somebody generally, if they don't qualify, meaning there's not an emergency need, generally they fall under the last category, which is from the waiting list by date of application when funding's available. And so if I'm answering it correctly, they wouldn't get an offer for that comprehensive waiver until we had enough funding in the budget to make P6, priority 6 offers, which are the folks off of the waiting list.
Okay, I've got a question here. You said earlier that you must use a waiver service every 90 days. So the question is, how much of a service must be used in order to continue to qualify for a waiver?
It's a good question. There isn't a threshold. It's just that a service be utilized. So in its simplistic answer, could somebody use 1 hour of respite every 90 days and be eligible for the waiver? The answer is yes. But again, those would be conversations I think that the planning team has to have, because again, it goes back to how are supports being delivered to somebody who qualifies to live in a nursing home or an intermediate care facility and only need 1 hour of respite. Not saying it's not possible with a ton of natural supports or other systems in place, but we want to be careful that we're really using the waiver as a way to prevent institutional placement as an option for folks, and we're not using it as a Medicaid eligibility category, if that makes sense.
Okay, next question. Clarify, please. Housing that isn't 24-hour care, like an apartment, is that under the day waiver or the comp waiver?
If somebody lives in their own apartment and needs intermittent support, meaning less than 24 hours, that service is called independent living. There is another service then called supported family living, which is when they live in the family home and staff come into the family home to work with the participant. Both of those services are available under both the DD day waiver and the DD comprehensive waiver. And to clarify the 24-hour, that's a service, it's called residential habilitation, and it is only offered in the comprehensive waiver. And again, that's a waiver service where they get 24-hour residential. So most people refer to it as the group home. They live in a provider group home with other individuals and shift staff 24/7, or there's another model that is called shared living, where they live with a family that takes care of them 24/7, which is a contract with an agency. Those are the two kind of 24-hour facilities that we see in that comprehensive waiver. And that service is not available in the day waiver, only the comp.
Okay, another DD waiver waitlist question. If you apply and are denied to be on the DD waiver, how soon can you reapply? And once a child is on the wait list, do they have to be reevaluated by DD services at the ages of 9 and 18?
Okay, just trying to write them down fast. I'll try to get the first one. So if you applied and you were denied eligibility for the DD waiver, there is not a specified time frame that you have to wait to reapply. I would, however, ask just for everyone's time, that to reapply, you really would want to have new information or new evaluations. If you reapply with the same evaluations that were considered in the initial determination, obviously it likely won't change that decision. So I guess there's not a waiting period to reapply, but I would say that folks need new information to reapply. If they're hoping for a different decision, if it's ineligible and you're wanting it to be eligible, so you reapply, you would obviously need new evaluations. And then the other one was about 9 and 18-year-olds.
Yes. Once a child is on the wait list, do they have to be reevaluated by the DD services at age 9 and 18, just while they're on the wait list?
Yes, they do. And so eligibility is redetermined at 9 and 18. Again, there's different criteria if you apply prior to age 9 in the statute, as far as needing substantial functional limitations. In those developmental periods, oftentimes, because one of the requirements in statute is that we have to be able to prove that the disability is going to have limitations that will be for life or into adulthood. And oftentimes on young children, we just don't know quite yet what that's going to look like into your adult life. And so at 9 and 18, we are required to reassess eligibility to ensure that you continue to have substantial functional limitations in the areas that are required by statute.
Okay. Regarding the wait list, can an individual be given details of their place on the list?
So excuse me, the simple answer is yes, you can. We do not provide it to staff across the state or service coordination. I have it in my office, as well as my program specialist that oversees the wait list. We often are a little cautious with giving it out, and here's why: because it changes every day with folks that, so right now we're in a process where we're making waiver offers currently from the wait list. And as people deny their offer or withdraw their placement on the waiting list, it moves people around. And oftentimes there are children, as I explained earlier, there's children on that wait list who don't have Medicaid eligibility, and they move around as well. So if I were to give a number and say, well, you're 522, it doesn't mean you will always be at 522. Now, you shouldn't obviously move to number 1 or number 6,000, but there can be slight changes just based on where people are at and their denials or acceptance of services. That it is possible, and I can certainly, what I generally give instead of here's the number you are, is I give your date of application. And then I can tell you where we're currently making offers. So earlier when I said we're currently making offers for dates of application dated 2011, I can tell you, if you called me and I could say, well, your date of application is 2013. And then that gives you some perspective. And I can say about how many people are in between there, but I try not to give too much false hope that people think, oh, I'm only 100 away. That's got to be within the next 30 days, or because there's a lot of forces that go along with how folks come off that wait list. So I purposely don't want to give folks false hope, but I also want people to have a realistic idea of where they're at as well. So you're more than welcome to reach out to me.
Okay. So speaking of funding in the wait list, there was additional funding allocated by the legislature. Where is that going? And will folks that need the assistance benefit from that?
So we did receive additional funding this year into the developmental disability budget, but we did not have a specific appropriation for the waiting list. The additional money that came into the DD budget this year had very specific places where that money was earmarked for. And here's my technical challenge. I was going to try and pull up my email separately because I have it all broke out in an email, but can't get to it. There was not specific money for the wait list, and so we'll hope next time maybe we have some specifically for the wait list. The offers that we're currently making today, when I talk about the 100 offers we're making off of the wait list today, Those are being funded with existing dollars in our budget that were freed up through attrition.
Okay.
Either people leaving the waiver or folks no longer utilizing services at a certain level.
Okay, we have quite a few questions here. I don't know if you want to continue on a little bit with the presentation and we can get to more questions as we go, or how would you like to?
Sure, maybe I'll run through kind of the 4 different waivers and talk about the services, and then we can go back to just open-ended questions. And they're all valid questions, certainly. Some not in my presentation, but I'm happy to try and get you any answer you need. So let's go through some of the waivers, and then we'll kind of circle back to other questions that might bring up. So I think we're going to start off with the developmental disability waivers, and specifically on slide 7, you'll see the DD waiver services that are available. There are also some nice pieces. I'll encourage you also to go to our website, where we have some very easy to read brochures about the different waiver services and the definitions. There's also a very nice piece on the website that you can print that will show you all 4 waivers side by side with a little checkbox of which services are in which waiver, so you can have it all together on one piece of paper. But these are the services that are available under our the DD day waiver. Or actually, these are actually all waivers combined. And again, the primary difference is that if you see on the far right, the top 2, the Res Hab service, the host home, shared living, and group home, that's a service specific to the comprehensive waiver. So if you look on the next slide, we'll talk about the waiver service types. All of the services that go under the waiver really fall into 2 main categories at the federal level. They're day services or residential. Day services generally focus on those services you get during the day, community inclusion, could be job skills, employment, and any vocational support that we would provide during the day. Residential generally focus on your independent living skills. And again, those are services tailored to provide support in your home, in your family home, or in a provider-operated home. And then one of the things you'll hear about the DD waivers, both of them, is you'll hear that term habilitation. They're habilitation waivers. And so I just put in there just a little blurb about what is habilitation, because I have a lot of folks that just say, I don't know what that means when you say habilitation. And it really is a term that means whatever we're doing to support you to gain skills or maintain skills. That's how I explain it. There's a little more words in that box than I say, but it's really anything we do to support you is habilitation. Again, to be eligible for the DD waiver, you have to be a legal resident of the US, a resident of Nebraska. You have to have qualified through that eligibility process as having a developmental disability, which is defined in statute there. And we've laid out the 2 criteria that must be met in statute. So oftentimes I get questions about how come I'm ineligible? I clearly have a disability. And that sometimes is true. So if you see the 2 bullets there under the definition for having a developmental disability, not only do you have to have the diagnosis and the disability other than a mental illness, you must also have substantial limitations in all 3 areas: conceptual, social, and practical skills. So sometimes, and a good example of this often is for folks that are kind of, let's say that they're diagnosed with autism spectrum disorder. And so they have the diagnosis, so they meet bullet number 1, but maybe in the substantial limitations, there's some deficits in conceptual, and deficits in practical, but they're really good at social skills. I mean, there are no deficits. They're able to carry on conversations, able to comprehend conversations. And so they won't have significant limitations in that area. So they only have 2 of 3. That will render an ineligible decision for DD. Because the statute today requires not only the disability, but the substantial limitations in all 3 areas. And as a reminder, the disability has to occur prior to the age of 22. And it has to be expected to be lifelong, that we talked about earlier. The application for the DD waiver, again, we mentioned this briefly. Our goal is always to provide you with accurate and very timely determinations. We have, for quite some time now, met a challenge that we had early on in the Governor Ricketts administration. One of the things we identified early on was the length of time it took for folks to get an answer on their application. And today, and for over a year and a half now, we have been able to administer decisions on applications within and well under 14 days after we get your application and receive all records. So one of the things that we did in our application process to change and make it more customer focused and friendly, we used to say, here's the application, and then also submit all your evaluations that support you have a disability and you have substantial limitations. And so parents were often left with, well, what do I give you? Do you need the IEP? Do you need a psychological? Do you need the doctor's report? And it was very confusing for families not knowing what we needed to comply with that statute. And so we changed the rules a few years back and said, all you have to do is fill out the application and then sign a release of information and tell us where those records might be. So you can say Westside Public Schools, University of Nebraska Med Center, and then we will send that release and specifically request the types of records that we need so that families don't have to do that. So when I say the 14 days determination, that clock starts ticking after I get the records from those entities, not the day you actually apply. Because under HIPAA laws, once we give a release to an agency like that, they technically have 30 days to give us those records. Now, many people turn around and give them quickly, but there are some places across the state that take the full 30 days to get us those records. So obviously, if families do have the records, it will go much quicker, but we do offer the service to go get the records ourselves. And so that's what you'll see there. Applications online. Don't really have folks doing the local office applications anymore, or once in a while a paper application, but pretty much the applications that are coming in are all being done online with families or support folks that are helping. Okay, and then the eligibility for the level of care, we briefly mentioned this as well, that move it box that came up, there we go. So when we receive the application, within 2 days, there's a call that goes out. The documents, like I said, arrive in 30 days. And then if they are determined to be DD eligible, we then move into that level of care assessment, which at eligibility would already be met, saying that you do qualify to live in an ICF. So we can move past that one. And then the wait list, there's some information there about when there's not enough funds. We do have the developmental disability wait list. Again, in order to be on there, you have to meet the ICF level of care, be on Medicaid or under 19. We don't require the Medicaid. Again, it's organized by your date of application. And then it also indicates which waiver the person is requesting. So most people request the comp waiver. We have very few that for long-term say, I just want the day waiver. The eligibility there, 9 and 18. So this is the waiver prioritization that I mentioned earlier in statute. This is just exact verbiage that comes out of Nebraska statute 83-12-16. So this tells you in a nutshell, if DD was either given money through appropriation from the legislature or we had money through attrition, anytime you have money available to support people on the DD waiver, here's the order in which you must give out the money. So we always have to go to, if I have $1 today, I first have to go to the team and say, do I have anybody in immediate crisis due to death, homelessness, or threat to life or safety? If not, then I can move down to priority 2, folks that have lived in an institution, such as an intermediate care facility for the last 12 months, and they want to move out to community-based services. We check to make sure there's nobody wanting to do that, that would be waiting for funding, which they never are. We do that right away. We make sure there aren't any state wards or probation youth that need that money that will be exiting the foster care system or probation system at 19. We make sure we have enough money to serve the youth that will be transitioning at 21. And then the military folks. And then after all of that, if nobody was waiting or eligible under those priorities, then we move to that last priority, which is all other people by date of application. So this is really the crux of how the division is charged by statute to give our money. It's really kind of our order of selection, if you will, for how folks get funding. Service coordination, when you're on the waiver, again, on the DD waiver, it's a service. You'll hear the individual service plan, or they call it the ISP, that supports them. And then the team for the ISP is really decided by the participant and the family, but they would be at a minimum the folks that need to be a part of the plan, and then often the providers and anyone else that the participant wants to invite to be a part of their plan. Okay, and then we'll quickly go through the other 2 waivers. Aged and disabled waiver. Again, we talked about that waiver earlier, but you'll see the services that are available under the aged and disabled waiver. Some similar services that you saw on the DD waiver in the listing here, and some different services. So again, they're not the same services, and the reasoning for that is it's a different population. Remember, this waiver is for folks that qualify to live in a nursing home, and the other waivers were intermediate care facilities. Okay, so those were the waiver services. The eligibility requirements on the next slide are, in order to receive those aged and disabled services, again, be eligible for Nebraska Medicaid. Again, same issue with children, that they would get the Medicaid if they get the waiver offers, because we would consider them a family of 1, have a disability or be over the age of 65, meet the nursing facility level of care, and have a need for waiver services. And then if we go on to slide 18, there's applying for A&D services is a little different currently than DD services, in that referrals are made to the local service coordination offices. So in this waiver, the service coordination component is done in different ways. And you see they're kind of the different entities that provide service coordination. Generally, if you're 0 to 3, that service coordination is provided by the early development networks. 4 to 17 is done by DHHS service coordination staff, state staff. And then our adults and into the aging population is done either by the Area Agency on Aging or the AAAs or the League of Human Dignity. Anyone can make a referral, and then the participant and guardian or their legal rep participates kind of in that eligibility determination process. This is one area that I think we are looking at as we kind of have the HCBS waivers all administered together of really trying to streamline an application process for all 4 of the waivers, so that one isn't a referral to a local office, one is an application to Access Nebraska. I really want to create a system where, regardless of what waiver you want, there's one way to notify the state that you'd like to be considered for eligible status. And then we can determine which waiver to do that. So you might see a change in that in the future, but right now it's a referral to the local office. And then you will see, again, similar to the other ones, the timelines that we will have reach outs from a service coordinator, checking on the Medicaid eligibility status. And then when a person for the aged and disabled waiver meets the requirements, the difference here is that they can then go ahead and move into waiver services. This waiver does not have a waiting list currently. And so folks that are determined eligible, have Medicaid, and meet the level of care to live in a nursing home can automatically then enroll into the waiver. The adult aged and disabled level of care criteria is there. I won't read that to you, but it really lays out for you kind of what that looks like for adults, and then separately for children. And then our service coordination piece for aged and disabled waiver, again, has the different entities based on their age generally. But a participant, I think it's important to note, over the age of 18 can really choose where they want to get service coordination, either through the leagues or the AAAs, or if they wanted the state. Historically, folks have just naturally chosen early development network when their child's at the younger birth to 3. We move them to state service coordination through their teens, and then in adulthood, they really have the choice of league or AAAs. And generally, folks start out with the league and move over to the aging side of the house as they get older. But it is a choice of where they would like to get service coordination. The A&D waiver planning service, so similar to the DD waivers, they also have a plan that's developed for the waiver that's person-centered. They happen to call theirs a plan of services and supports, and the other one you saw us refer to it as an individual service plan. Again, perhaps another opportunity where we can streamline acronyms and perhaps just call everybody has a plan, and those plans are individualized to the services they need or the waiver there's on. But we may entertain some of that in the future for streamlining. But currently that plan is called, you'll hear it referred to as the POSS, or the Plan of Services and Supports for the aged and disabled waiver. And then quickly on the next slides, we'll talk about traumatic brain injury waiver. I won't spend a lot of time. This is a very small waiver. We currently only support 20 people on this waiver for folks that are getting services through an assisted living, specialized assisted living with Quality Living as our current provider. You can see on slide 24 that those are the waiver services that are kind of available within that waiver. And then the eligibility requirements would be after that. Again, be Nebraska Medicaid eligible, 18 to 64, have the diagnosis of a traumatic brain injury, also meet the nursing facility level of care, just like the aged and disabled waiver, and have needs requiring that type of care to treat their traumatic brain injury. Let's see what's next. So again, the application process currently is to contact the League of Human Dignity and the service coordinator for the TBI waivers in the Lincoln office that manages those cases. And I'll let you just read that again. It's a small waiver that we're currently supporting, but certainly a waiver that I think in work with our advocacy groups, we have an opportunity to expand and look at other services we might offer a larger population in the future, and not just folks that maybe need to go into assisted living. We've gotten a lot of feedback over the years of folks really wanting some in-home services for folks with traumatic brain injury that don't want to go to an assisted living that needs support. And so those would be some things that we would explore, I think, in future amendments for the traumatic brain injury waiver. Last slide on TBI also talks about their plan of support. Again, they're all person-centered plans, and they really just define the services and supports you're going to get from that waiver. Your last two slides of the presentation, or three, I guess, is I've got a resource page that you can go to that has some of those brochures that I talked about and eligibility criteria. There is a slide that shows you kind of what the web page looks like. And so you'll see there's a tab that talks participants and families. There's a lot of information if you click there and go into that, or certainly if you're a provider, we have a separate page for a provider, and then resources, which would be for anybody. And then my contact information, if you want to reach out to me directly on anything, happy to try and help you. So, sorry, that seemed like it was really quick, but I know you have a lot of other questions or questions about all of this, and I'm much more at ease just having conversation than reading slides to you. So I am happy to open it back up and take any questions you have.
Okay, we've got lots of questions.
Jennifer, can I just stop for 1 second? Sorry,
Sure.
I'm going to go ahead and stop sharing so that way we can kind of have more of a conversation about this. But you should have in your slides that I sent you earlier today, Tony's information. Otherwise, I will go ahead and put this back up towards the end of our conversation so that if you want to get his contact information, you will have that. Okay.
Okay, to start, we have a question about the Katie Beckett program. Asking, does your program administer Nebraska's Katie Beckett program, which is set at an institutional level of care, but waives parental income?
Right. So yes, we are the worker that is over and working on the Katie Beckett eligibility criteria is in our team. And so one of the things I always try to clarify, folks sometimes think that there's another waiver, and they often refer to it as the Katie Beckett waiver. It's actually not a waiver program as much as it is an eligibility criteria or category within Medicaid. And the person, I believe, is correct. It is a Medicaid eligibility category for folks that qualify to be hospitalized level of care, inpatient care. But we do
So kind of a
oversees that in my division.
okay. Again, with Katie Beckett, we've got two more here with that. If they are on the DD wait list but not receiving services, could they be receiving Medicaid services through the Katie Beckett program?
Say that again. If they're DD.
If they're on the DD waiting list,
Okay.
but not receiving DD services, could they be receiving Medicaid services through the Katie Beckett waiver?
Yes, that is possible. So that's again, Medicaid. So Katie Beckett, again, it's a Medicaid eligibility. So instead of having to qualify on your income, you qualify on your need to have inpatient level of care. And so that automatically gives you the Medicaid benefits. But yes, you could be on that Medicaid eligibility status and also on the DD wait list, not receiving services.
Okay.
Waiting for the DD services.
Okay. Last one for Katie Beckett. If we wanted to create other institutional levels of care for Katie Beckett, such as ICF or DD, who would make that decision? Does this get decided by leadership at DHHS or the legislature?
So it would be decided, that was kind of a loaded question. So the answer would be all of the above get to decide. I would love to say I just get to decide, but obviously creating new Medicaid services will require all of the above. What a waiver does is it allows you to submit that to the federal government saying, we are going to waive their ability to access, or allow them to waive their right to access institutional level of services. So either ICF institution, nursing facility, or hospitalization. So a waiver is really just saying, instead of an already funded Medicaid service, you can waive that admission and get services in the community. So a waiver is you're only able to have a waiver for an existing service that you're keeping them from, or promoting them in a different way, if that makes sense. Now, there are other types of waivers that you can do, demonstration projects and all of those. But this topic, I'm specifically talking about 1915C or HCBS waivers. But there are other kinds of waivers in a state. And again, those would be the same answer. The decisions would certainly be with the department and myself as the division director and the Medicaid director, but we also would have others that would weigh in on that decision as well.
Okay. My child qualified for the CDD, the Comprehensive Developmental Disabilities Waiver. We don't meet income requirements for Medicaid. We were told not to get on the waiting list until we are ready for services. Otherwise, we would have to pay for services. Can you explain this? So my child qualified for the CDD. We don't meet income requirements for Medicaid. So we were told not to get on the waiting list until we are ready for services. Otherwise, we would have to pay.
Yeah, so you might be, and feel free to email me if I don't answer this correctly, whoever asked that. You might be referring to two different things. And so if you applied and you qualify under statute as having an intellectual or developmental disability. You don't qualify for either waiver. That having the DD gets you access to either waiver. So you would have qualified as having a disability. The decision to go on the wait list after that is kind of an automatic. The program specialist would call, let you know that we've got your application, it's been determined eligible, and folks automatically kind of go on the wait list. I find it rare when folks say they don't want to go on the wait list. Otherwise, we don't know why they would have applied. So most everyone always goes on the wait list. There's another component while you're waiting for services, which is the service coordination piece. And that is where they will explain to you that you can stay on the waiting list and again, wait for services. But if you'd like to have service coordination while you're waiting, meaning someone to support you maybe with your child's IEP and your advocacy efforts with the school, or you're needing help finding community resources to meet some needs, and you don't qualify for Medicaid, that service does come with what's called an ability to pay, and you do have to pay based on income to have service coordination while you're not Medicaid eligible. So I think you're maybe talking about two different processes, but if not, and that's still confusing, please just send me an email and I'm happy to visit with you further about specifics.
Okay, if you have a child who didn't apply in high school for the DD waiver and is now 18 to 21, is now in the 18 to 21 programming, will the child still be able to receive day services upon exiting with a diploma?
Yes. Exiting, well, it was yes all the way up until, so when if they are going to exit prior to 21, we would want to have those conversations, because the answer would be no. The statute clearly identifies 21. And so if you decide to leave school at 18 or 19, there would not be services available under the DD waiver. But once you turn 21, yes, we have historically served all graduates leaving the school system at 21 and been able to continue that practice. So applying a year ago and turning 21 next month, you'll still get that offer for the day waiver. Your wait list placement, though, for the comp waiver will be the year ago date. So people that applied many years ago are going to be ahead of you for that comprehensive offer, but you will get the day offer at 21.
Okay. Again, a question about the services for the waiver for every 90 days. What if you cannot find a provider to help you with those services, such as respite, or especially in the rural areas?
Yeah, that is something that we have to work on as a team. So your service coordinator would need to be made aware of that, and I'm sure they are. But that really becomes a challenge that we have to, and oftentimes at the state level, we would need to reach out to provider networks. If it's agency providers you're looking at, oftentimes where I do see this as an issue is with folks that perhaps don't want an agency provider, but they're looking more for an independent provider, and they're having difficulty finding an independent provider. So sometimes we have to have the conversation about maybe there's not an independent provider, but there is an agency willing to provide that support with a staff person, and we just have to change the type of provider. But if neither are available in an area of the state, it is something that we have to have a conversation about, because we are responsible to ensure that our services are accessible. Now, that is not defined to mean, you know, every service within a 5-mile radius or 10-mile or 20-mile, but you have to have some reasonable level of access to services, that we couldn't have every county west of Hall County not have services. We would have to have services throughout those counties to consider it available to folks. But you would, if that were reality and we were trying to secure, we were perhaps placing ads for independent providers, or perhaps asking the different agencies to provide staff, and we're still unsuccessful, I believe we would have some room within the waiver to authorize an exception that if there were active efforts to secure providers and that was the issue for not accessing services, we would continue to work on having the waiver slot available. In my mind, I can't see that we would stop that just because of that.
Okay. Here's a question kind of deciding between the A&D and the CDD waiver. If my child is already on the A&D waiver and is on the CDD waiver, how do we make the decision between which waiver best fits the child's needs?
Yeah, I think the answer today would be to have that conversation with your service coordinator. Certainly look at the information on the website that talks about side by side what services are available in each waiver. Oftentimes what it comes down to is making sure that you have identified what your need is to your coordinator, and then we can make sure that we get you to the right waiver based on the services available. So, one of the dilemmas as far as, so there's two different processes kind of going on with the aged and disabled. If you are made an offer for the DD waiver and you're on the wait list, if you deny that offer, you would have to restart the application. So there is that piece to consider too. But which has the better service to meet your needs is really, for me, I think that's a conversation with the service coordinator. to help guide those discussions. Now, they also are, learning each other and the different waivers. And so I'm not going to be naive to think that sometimes if you currently have an aged and disabled worker and you say, well, which is better, AD or DD, that they say, well, I don't know, I'm not sure what DD offers. Hopefully that's not the long-term answer you get, but it could be the answer you get today. Excuse me. As they're kind of learning each other. And if that's the case, just elevate that up to a supervisor, because somebody should be able to sit down very clearly and articulate for you, here's what's available under this one and what the limitations are or the parameters, and help you make that decision. I really don't want folks fretting over which waiver I should pick. And then I have had parents call me and I've walked them through kind of those decision matrix too. And so if that helps and you don't feel like you're getting good advice locally, I'm also happy to have a conversation with you.
Next question. As far as eligibility, how does the state review team play into the waiver eligibility for children?
So it does, it does play in. So it factors in for children generally in the aged and disabled waiver that don't have the Medicaid criteria, and we look at what the application with Social Security is like. I will be honest, that is not my expertise. That process for the state review team is a Medicaid function within the Medicaid division. It's not something I administer in DD, but if you have specific questions about the SRT process, I would be happy to get you to the right person. But I couldn't speak to that program very well, or that process, I should say.
Okay, you are eligible for a service coordinator once approved for DD services. But if the child does not have Medicaid, what is the cost of the service? And is a service coordinator beneficial if no waiver services are in place?
Yeah, so the cost, again, it varies. It's on a sliding fee scale. So you fill out a financial questionnaire and it's based on your income of what you pay. Is it beneficial? I would say it really depends. I generally tell our program specialist that has these conversations, her and I both kind of say the same things when families ask us, is for some folks, it's not very beneficial. You have a good relationship with your school system, the school's providing all the services you need. You're able to get respite through natural supports or family members or through the lifespan respite program. And you really don't have needs per se. It probably isn't a beneficial service. That it becomes more just a once a month, hey, how you doing? You ask, am I still on the wait list? Yep, you're still there. And so why pay, $120 or $80, whatever the sliding fee would come out to have that conversation. So perhaps not beneficial for some, but then others who maybe really struggle with their student, their child and the IEP team, and you want us present at meetings to help advocate for what you want to see delivered as part of the school system, then maybe it is beneficial. But even then, we have conversations about some other wonderful organizations out there that can help assist with that advocacy, like PTI or others that can do that. So sometimes it's not a benefit. I think there are folks that used to think, well, I have to take it because then I'll get funding quicker, or it helps me get my funding. And I want to make sure folks know that that has no bearing. You are absolutely fine to apply, be determined eligible, go on the wait list, and say, don't call me every month. and don't have service coordination. We would be happy to put you in that status. But if you need us, we certainly can assist. So again, I think that's the same conversation with somebody to say, really, what would you do for me? And Kathy, who is my program specialist over the wait list, really has those conversations with families at the beginning of if it's appropriate or not to take service coordination.
Okay, somebody just asked if you could repeat the date that you said that they're making offers for people who went on the wait list.
So currently we are 2011. It's either like this, I think we're into December or January, so it's either really late 10 or early 11, but I think they told me we're moving now into 2011.
Okay, we have an advocacy question here. Where should the parent power best focus their advocacy for increased funding, at the state legislature level or at the federal level?
I would always say both. Certainly at the state level, you'll see more action quickly when you're talking about, wanting funding. At the federal level, certainly things take much longer. But if your goal is to have more funding to reduce the wait list, that would certainly be state level senators that you would want to advocate that to. If it's a higher Medicaid reimbursement to states, that's a federal decision. But yeah, generally I would say your best bet is locally with your local senators, and because they also have access directly to our federal folks too, and can pass things on if there are federal things that would need to change. But locally would be your best bet.
Okay. So if a student is aging out of foster care and is eligible for DD services, are they prioritized for the comprehensive waiver?
Did it say they are eligible for the DD waiver?
Yep, they're
Okay.
eligible for DD and they're aging out of foster care.
Yep. So in that slide in your packet that referred to the 6 priorities in statute, I believe our foster children and probation children that are leaving that system at age 19 are priority 3. And yes, though they would automatically, assuming we have funding, and we always have, we've never had to turn away a state ward yet, they would be able to transition into the comprehensive waiver at 19.
Okay. If a family is in crisis, who do they request priority funding from, or how do they request it?
Sure, good question. So if you are in crisis, and again, I would refer you back to that slide that talks about the 6 criteria, because crisis is defined in priority 1. It's got a limited scope. So again, it specifically calls out crisis as being homeless, the death of a caregiver, or a threat to safety or life. So if a family feels that they meet one of those 3 criteria, then they would make a request through actually anywhere. You can certainly, if you have service coordination or a local office, you can make that request there. You can email or call the number at the end of the presentation. There's an 800 number. You can call that number. Let us know where you're located, and we'll get you to a local eligibility, or excuse me, a service coordinator that can help initiate that process with you. Obviously, if somebody feels they're in that crisis but they haven't applied yet, we would start with the eligibility folks to actually apply. But if you're on the waiting list currently, already determined eligible, and feel that you meet that definition of a priority 1 in statute, you would just need to reach out to us through any means, and we'll get you to the right folks.
Okay. We have a question here. Who determines eligibility for the A&D waiver?
The local service coordinators.
Okay.
They have the referral process and eligibility decision making. Again, some of it if it's we have program specialist RNs that also assist in that process for medically complex cases and that review those, but it generally is at the service coordination level. Either the state service coordinator or any of those contracted coordinators that we talked about.
Again, with the children on the A&D versus DD, if your child is on the A&D and has is on the age and disabled waiver and has intellectual or developmental disabilities, what are the pros and cons of staying on the A&D waiver as an adult versus transitioning to DD waiver? Do the pros and cons change if it is the comp waiver versus the day waiver?
Yeah, I don't know that I could answer with a list of this is the pros and cons. Again, I think that based on the service array that's available within each waiver, those pros and cons would be specific to the family and their needs. So that would be one that I would say I'm happy to have a coordinator walk through what your needs are and looking at those services, but each one is intended to fund a different need level. Again, one's nursing facility, one's ICF, and each has a different package of services. And so we have some folks that find it very advantageous. They love the aged and disabled waiver, and they don't plan to move off of that waiver. The person now as an adult is going to stay in the family home, continue to get supports. We have others that decide, no, I think I'm ready for Scotty to move out of home, and I think I want to try the DD waiver. And so it really is a family choice and a family's needs that drive which is best.
How are referrals made for the aged and disabled waiver for ages 3 to 5?
So if they're coming, if they're a referral, they go to the local service coordinator. So if you don't know, any one of our HHS offices, if you were to call and say that you are interested in the aged and disabled waiver, we would get you to the right service coordinator to help assist with that process.
Since the Division of DD is now administering waiver services for individuals who may not have DD, has there been any consideration for renaming the division to Division of Community-Based Services or the Office of Disability Services?
Very good question. So I'll try not to make this a long answer, which some of you will laugh because you know that's impossible for me. But so the short answer is, have we talked about that? Yes. One of the things that we have been working on, and you as advocates and families and providers have all been saying is, how about we break down the silos at HHS? How about Medicaid talk to DD, DD talk to behavioral health talk to children and family services. And so I'm excited that we're doing this because it really is the beginning of that, right? I think everyone knows we had the 4 waivers, 2 completely separate divisions. Neither one was administering incorrectly by any means, but it just makes sense that if you're going to have resources and services for defined populations under one authority at the federal level, well, let's put all 4 of them together and start administering them together. Still can have unique processes to each population, unique services to each population, but some things there is the opportunity to streamline and make things better for the consumer. So the piece I mentioned earlier about maybe one application for all 4 waivers to one place. That to me seems like the right way to go, as opposed to, well, if you're 3 to 17, you go here. If you're DD, you go to Access Nebraska. We can just say HCBS, here's one place we go. So I think this has really been in line with what people have been asking for a long time, is to break those silos down. And so one of the things that we're working on with CEO Smith at HHS is start to operationalize things and see how they start working together, right? So we purposely are beginning to come together and administer the waivers. So the Medicaid staff that are currently or were working on aged and disabled and traumatic brain injury waivers, yes, they're a part of my support network in DD. They still get paid out of Medicaid. So we're really trying to portray this, that this is HHS who is administering the 4 waivers. I happen to work for the Developmental Disability Division. Some of my staff work for the Medicaid Division, but it's the larger HCBS system. To your point of, because they're different populations, and I am sensitive to that the name sometimes, even though they're still Medicaid staff, things coming out of my division often have that logo or that letterhead that says Developmental Disabilities. We are looking at that. As folks know, that would require a statute change. And so what we want to do internally at HHS is make sure that we know how to operate it and it works well before we would go through the process to say, hey, change our name and put everything aged and disabled into one division. And so you will begin to see myself and others working together in programs that historically hadn't been in this. So the 2 waivers, I'm also working with our state unit on aging administrator. I'm attending meetings with the AAAs on aging services. So we're beginning to learn each other, and then I think the time for the name change will come down the road. But it is a discussion, but not probably something tomorrow or this legislative session. We're really trying to figure out how to operationalize it first before we go request the name.
Couple questions on the TBI waiver. Which application would be appropriate for a child with a TBI? Which waiver application?
Which waiver for a child? So the TBI waiver would be for those 18 to 64. And again, that one is also, I believe, just a referral to the service coordination folks. I haven't had a whole lot of dealings yet in my learning curve on the traumatic brain injury waiver, but my understanding is it is at the local office. So I would say if there's uncertainty of which application or where you're at, I would call that 800 number at the end of the presentation, which is somebody that sits right outside my office. And we'll get you to the right spot if you explain what your needs are. We can direct you to which application or what services you might be looking for.
What happens if you have a TBI and there are no open slots? There are only 20. What services can you even get?
You would not get any at this point. And that is something we're looking into. So you heard me earlier say there is currently not a wait list on that side of the house. What I'm unclear of yet, because there isn't really a formal application process, I'm not sure if folks, to the question, if folks have been applying and they're at max capacity in that facility, are people just going elsewhere and not creating a waiting list, or should there be a wait list? And that is something, honestly, I am looking into with our folks from Medicaid that have been working on that waiver. Is I just don't have a good handle on if that's occurring. If folks are applying and saying there's not a slot available, then what happens? So today I'm not sure, because under the waiver, no, there wouldn't be other services generally. It's primarily just the services receiving through quality living.
Do any of our home and community-based waivers allow for family caregivers to receive pay for the care they provide for their child/adult child?
The waivers allow us to pay so we do not have the ability to pay under the DD waivers directly to family members. We can well, family members is loose, so we can't pay to a legal guardian. Now, there certainly are family members who do enroll and go through the Medicaid process of becoming independent providers, and that is allowed, but an actual guardian or parent caretaker cannot be paid if they have legal responsibility. So a parent for a child under 19 cannot be paid because they're legally responsible for the minor, and an adult for which you have obtained guardianship through a court over cannot be a provider.
Is that the same for the A&D waiver also?
I should know that off the top of my head, but I don't know.
I think for the A&D you can if it's not,
I think that
if for an adult child, I believe.
I will check.
What would the benefits and downfalls of having a fiscal intermediary agency be for independent providers?
What would the downfalls be?
What would the benefits and the downfalls of having a fiscal intermediary agency?
So I think the benefits, and we're certainly looking at this currently, as it has been a recommendation in Nebraska that just hasn't come to light yet. But the benefit would be for independent providers to have many of the supports that you traditionally see in an agency. So perhaps that supports with training, supports with ensuring pay and oversight, quality, those kinds of things are all benefits that would be a result of having that system. And so it is something that we are exploring in Nebraska of how we might go about obtaining that, because independent providers, while it's a very beneficial way to deliver services, it also often has some unintended problems when it doesn't work well, right? So it works really well if you know the provider as a family member, you're training them. But all of a sudden when life happens and that independent provider is not there and you're needing services and support still, often that's where we see the benefit could be that you have somebody to go to help navigate that process, where today, as a family member or guardian who's choosing to do independent providers, that responsibility is now back on me to figure out who to provide services for, right? I don't have an agency that I can go to that says staff A quit and I need a new staff tomorrow. As an independent provider and a family member, I'm stuck with either delivering the service myself or trying to find new folks. And then the fiscal piece is a big piece of that. It is very tricky in how we pay and overtime, especially when we have providers that move from one program to another, when they do some hours under the waivers, some hours under the state plan. This entity would house all of that information and ensure that we comply with all the labor laws that go with that. So I see it as a benefit. We just haven't adopted it yet here in Nebraska.
Okay. Do you know how many people are approved for priority funding each year?
I do. Let me see if I have something that would show off the bat. So I can give you, I have in front of me just the last year and the current fiscal year. So last year, it looks like we made 315 offers off the wait list. And this year, we are at 121. And that would not count the current 100 that I'm undergoing right now. So if whoever is asking that is interested more kind of in planning or what that's looked like year over year, I do have at the office a chart that shows historically what those offers have looked like for the last several years that I'm happy to share.
Okay, question here. Can you be more specific as to what local services coordinator, who they are? I'm not sure what this was in reference to.
So when I say local service coordinators, I'm really saying you should be able to call any local HHS office and let them know that you have a question about developmental disabilities or the aged and disabled waiver. And generally, in most offices, I would have a staff there that could answer the question. And if it's an office that we don't happen to have a service coordinator at somewhere in the state, they can transfer and get you to the right person. When all else fails, that 800 number that is in the slides, and Rhonda posted it here to the chat box as well for you, that is our centralized number that if you call there and explain what you need and where you're located, they'll direct you out and get you to the right local office or to the right service coordination team.
Okay, we've got another couple questions here on the fiscal intermediary. So would the state be the fiscal intermediary, or could it be an agency?
The state would not be. It would be a contract that we would have with an outside entity.
Okay. Would this be a competitive bid?
Yes, in that we're required to, under certain circumstances and under certain dollar amount thresholds. So generally, anytime you issue or enter into a contract over a certain dollar amount, we do that through RFP processes. That being said, and again, I'm not speaking to this specific project, just in general, there are other ways though that the state has the ability to enter into contracts. So I can't specifically say, not knowing what this would entail, but I am certain the dollar amount would be at a threshold that would certainly need us to bid that out.
So the fiscal intermediary would also train independent providers.
That certainly is how some states have set theirs up. Again, you kind of can define how you want that to look in your state, and not every state does it the same, but in some states, training of independent providers is a function of that fiscal intermediary.
Okay. Just a little comment here. Tell Tony he is a rock star and we love his willingness to educate us on these services. As far as the waivers, amendments you spoke about, and is the A&D waiver coming up for renewal? And how do people make comments on that?
Yeah, it's a good question. So the A&D waiver is currently set to expire July of 21. And so generally a process to either amend or renew your waiver is, I always say, a good 6-month process. From really when you start kind of writing it and putting it out there for the public. So obviously with it expiring in July for the aged and disabled waiver, we are planning to put it out for public comment somewhere around March, April. We do a 30-day public comment period. And then after that, we take the feedback, make any adjustments, and then submit it. And then CMS has a 90-day window that they get to review and ask the state questions. They can start and stop that 90-day clock. And so it has to start many months in advance. So you will see the aged and disabled waiver coming out in early spring for its implementation August 1st. And through that public comment period would be a way to give feedback. But I also, similar to what I do on the other, or have been doing on the DD waivers, will certainly replicate for the aged and disabled and the TBI waivers, is I like to also get stakeholder and informal feedback before we just go to a public comment period. So we will always share in whatever forum I can informally that here's what's going into the waiver, or here's the changes we're going to do, well ahead of the public comment period. Anytime that anyone feels that they have something they would like to see changed in a waiver, added to a waiver, deleted from a waiver, you absolutely can email myself and we'll get it to the staff or any of our staff that are over the various waivers, but we would take feedback anytime that would try to be incorporated into subsequent amendments. But you will see the A&D waiver coming out in the spring for its official renewal.
Okay. Question, why does our service coordinator change so often? Is this typical?
Yeah, unfortunately, I would have to say in many cases it is typical, but not desirable. That is not what I want in any of our systems. But case manager turnover, both in our system, our child welfare system, probation system, we're all experiencing high levels of turnover at what would be entry-level case management type positions. And so recruitment and retention really become things that each of us have to focus on pretty intently. But it is a lot due to turnover and vacancies, unfortunately.
Does the DD waiver have a mechanism to provide childcare?
Yes, and we're undergoing in the DD waiver, we'll be undergoing here very shortly, a waiver amendment where we are redefining our child day services and our adult day services that will be more broadly inclusive, knowing that we have folks that are moving from the aged and disabled waiver over to the DD waiver. Today, there was not a comparable service for some of those folks that transferred, but I believe they've through the service planning teams have figured out how to meet folks' needs. But in this new amendment that's going forward for the DD waiver, we have a child day definition that includes both the traditional day of what DD kids look like when they're not in school and the traditional child care service that folks did receive under aged and disabled. So it is coming.
Okay, and this looks like it's the last question, unless anybody has anything they want to get typed in there quickly. Can you provide a quick overview of the changes made to the DD policy manual?
So my short answer would be quick, probably not. And I don't have any of those materials with me. I'm sorry. So I would likely pass and say I probably couldn't off the top of my head just recite changes within the policy manual. And I'm sure if I have any staff out there, they're like, please don't, because I'll probably get it wrong if I tried to do it up from memory. But happy to give whoever needs that summary. I can certainly send you some information if you want to email me or I would imagine there are things on the website as well.
I think that's it for questions. So
I think we're kind of running low on time here. So lots and lots and lots of great questions.
yes, thank you.
Yeah, I did want to go ahead and I'm going to put Tony's information up on the screen just one more time in case anybody, after having this conversation and going in a little bit further, maybe would like to reach out to him. So I'm just going to take a moment and do that real quick so that you can go ahead and get that information. Tony, I know we've had you come and share your information and wisdom with us several times, and I always learn something new, and I really appreciate you answering all of our, kind of very broad questions. But I think it's been really helpful. We've gotten really great feedback from families that it's been helpful. So I really appreciate you taking the time tonight.
Good, not a problem. As always, I kind of end these with, I'm happy to do these in any forum. I know some of you are providers or advocacy groups or part of different parent associations. Happy to come speak to any group. I certainly don't ever want this challenging system to feel like a challenge to you. And that's a difficult task some days with a multitude of programs that we operate at HHS. But always happy to try and make that as easy as I can for you all.
Well, we certainly appreciate it. And I know we probably will be asking you to come back as we have things change or just kind of go a little bit more in depth, because I think you do a really nice job as far as being able to kind of break it down and help people understand, which is a very complicated system. Yeah. So thank you. Appreciate it.
You're very welcome.